And welcome to the big story tonight, a special edition, as Carter mentioned. Are you hoping to feel and look better? Will a more youthful appearance help you in today's tough job market? We've got the answers to these and more of your questions because tonight's big story features Dr. Michael Gray, renowned cosmetic surgeon of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Now, if you have a question for Dr. Gray about cosmetic surgery, you can call right now, 800-859-0WJR, 800-859-0957. Let me give you a traffic update before we get started. No problems on the Big 7 at the moment, but overnight construction east and westbound I-96 between the Davison and Livernois. Only one lane will be open from 11 p.m. tonight until 5 a.m. tomorrow morning. Clear skies tonight, low 62. Tomorrow we're going to have more sunshine. It's not going away yet. High 83 right now in Detroit. Sunshine and 79 degrees. I'd like to welcome back to the big story in the studios of WJR, Dr. Michael Gray. Dr. Gray, it's good to see you again.
Thank you. It's always great to be here.
How you been?
Been very well.
And we want to talk about cosmetic surgery, and we had you on once before, and we had a great response. A lot of people have questions about that, so we decided we'd like to bring you back and try to get more of those questions answered that we didn't get answered the last time. And I know that we've read that recently that women under 50 have not turned their backs on cosmetic beauty enhancements.
You know, I don't think anybody's turned their back on it. I mean, how can we? It's something that's going to happen to us. We're not going to age like wine. It's not going to get any better. It's only going to get worse. And when you wake up every morning, you look in the mirror, you brush your teeth, it's not better. So there's one way you can slow it down. You can try to reverse it, but things move forward.
Well, so that old adage that, you know, I'm older, I age like fine wine, it's not really. I
don't know if we age like fine wine. We're going to age, though. You know, maybe like wine that's left open, vinegar. But, you know, no one minds getting older. It's looking old they don't want. You know, I don't mind getting older. Mm-hmm. I don't want to look the part.
So
that's the thing.
One thing about the actual numbers. But it's another thing.
The numbers is just looking at. You know, I don't want the skin falling off my face. I don't want the wrinkles. You know, I want to prevent things when I can. That's the ideology behind, you know, the skincare. You know, you want to prevent that from happening.
800-859-0WJR, 800-859-0957. If you have a question for Dr. Gray about cosmetic surgery or non-invasive procedures. Have you seen, Dr. Gray, more people who want to look and feel younger to be able to compete when they look for jobs and things of that nature?
Yeah, the trend is people, getting bored. You know, they want some extra income, going back to work. And recently I had a gentleman who was an executive from Sony come in, took a buyout, but he's not going to retire. He's, doesn't want to. Mm-hmm. And so he came in and, we did his eyes, we did his face, we did his neck. It looks great. You know, when he came in, it was hanging.
Okay.
And the reason for him coming is going out and looking for another job, and he wants to compete amongst people who are younger than him.
Now, how old was this guy?
You know, he was in his 50s.
In his 50s, okay.
Not too young to retire, but wants to work.
Still has the energy to get out and go.
Yeah, he was a pretty smart gentleman.
What are some of the most popular surgeries that you deal with, the procedures that you deal with at the Michigan Cosmetic Surgery Center?
We do everything. Anything that you can think of we can do. I do things that I love, and I'm good at everything that I do. That's what I offer. I don't like hair transplants. I can't stand putting one hair follicle and 10,000 to one and 10,000. I don't want to do that. Mm-hmm. But basically we do everything. I do facelifts, neck lifts, ears. We do correction of nipple deformities, areola deformities, large or smaller, inverted nipples, breast reductions, enlargements, the gamut. But the difference is that I just don't offer one way. I offer all ways, and I let the patient decide which way they would like to proceed. And I go over the pros and cons with them so they can determine what exactly they want to do. If they wanted to do something non-surgical and go slow, we offer that. You want to do something more aggressive, you want immediate results, immediate satisfaction, we offer those types of procedures. So there's a whole gamut of things that are out there, new technology. I was just discussing with you earlier, when I ask you what type of car you have, it doesn't tell me, if you have a Model T or you got a Rolls Royce, but the smart lipo has just launched their new generation of machines, which is Smart Lipo MPX. I just happen to be lucky to be the first one here to bring it into Michigan. And that machine is amazing. It reduces much more fat. It smooths cellulite. It tightens skin. And it's much more powerful and all done safely because they have incorporated into the machine temperature monitors, and it's all high-tech. The machine is about 10 times bigger than the original machine that they launched.
And what's the recovery like? About the same, or is it better?
Well, I just did a patient the other day. I reduced her breasts with this machine. So that because she didn't want a classic breast reduction. She was a physician. She didn't want any downtime. She was going away on a conference Monday. And she came in. We reduced the volume. I called her up that evening to check on her. And she said, absolutely no pain. Nothing. Nothing. Not even sore. She was really impressed by this. And the other woman I did her neck and her cheeks, her abdomen, her thighs. And she's fine. I mean, I did... last time I spoke, I told her I did the external ultrasonic lipo on my waist, because you can't diet anything away. It's like hating a painting and redecorating the whole house. Dieting affects the whole body. There recently came out a study. I don't know if you heard it.
I saw that, yes.
Where it said that they're not quite there yet knowing what they're saying, but what they're saying is women and men who diet look older. What they're really saying is that people who diet lose weight, but it first comes out of the face and breasts in females and face in males, and when you lose it out of your face, you look gaunt and you don't look healthy. You don't look good. You can't diet specific spots or exercise specific spots away. So that's where, ultrasonic lipo comes in, where it can smart lipo can target specific areas of the body.
800-859-0WJR, 800-859-0957 if you have a question for Dr. Gray. Let's go to the phone lines. Abe from his car. Abe, you have a question for Dr. Gray?
Yeah, not pediatric, but adolescent gynecomastia. What's the best way to handle it, Doc?
Well, if it was me, I'd want to use 3 teeny puncture holes and suck it out. I wouldn't want to get cut. It's unnecessary to be cut. So that's what we offer. We do ultrasonic lipo, which liquefies the fat, most of it's fat in men. Men have very little breast tissue, and 99% of the time it's fat, and it's not breast tissue. And what we do is we reduce it through puncture holes. The skin flattens down. You deflate. If you need a tightening, that's where the smart lipo will heat up the tissue and causes tightening, also further reduces more volume. We get both breast tissue reduced as well as fat reduced with these procedures. And the way it works is I wouldn't want to do anything to someone that I wouldn't want to do to myself. So my recommendations follow that.
What's the complication percentage? And I don't know, what's that usually run?
Well, I haven't had a complication. It's like getting cut. The risk of you getting an infection is very unlikely. So, I haven't seen an infection in, I don't know, maybe 10,000 patients that I've done just the lipo reduction. It costs, I think it's, I don't usually handle this in my office, but I think it's like about $1,500 or $1,400 to do this. And it takes about less than an hour to do. You don't have to be under anesthesia. We can just localize it, numb it. Most people just come in, we numb it, do it, and they drive themselves home. And there's no restrictions on your activity. It feels like a Charlie horse. So believe me, I wouldn't be doing my waist if I had any downtime because I don't have downtime.
That's right.
And that'll also work for adolescents, though.
Well, yeah, we typically would start earlier on younger individuals because once they get into the gym class, they take off the shirt, they'll be annihilated by their peers. So we don't have a problem doing it with younger children.
Abe, thank you so much. All right, Abe, thank you so much. Let's go to the phone lines again. Tony from Grand Blanc. Tony, you have a question for Dr. Gray?
Yeah, I'm wondering if he'd just give a short synopsis on scar tissue and how lasers will work with it, because I have a close friend of mine who's a medium to dark-skinned African-American, and he wants to know why the colloids are thicker on his skin than they are on mine when we get scar tissue. And can that be taken care of?
There are different types of lasers that are available. Right now we're using laser genesis to treat hypertrophic scarring. That's where the scar actually looks like a speed bump. It just goes up like a bump. That's hypertrophic, and that is not a keloid. A keloid scar, no one really knows exactly why these types of scars occur. If we had that answer, everyone would have a fine line or an invisible scar. So scars basically heal 4 ways. They can be a fine line, they can widen over time, and scars mature over 2 years. The scar is going to be elevated like a speed bump, which is called hypertrophic. Trophic is growth. Hyper means more. And the last one is the keloid, which everyone calls a hypertrophic scar, but it's not. A keloid is a scar that actually grows up and flows over the surface like a mushroom or an umbrella. That's more common in African Americans, Indians, and Asians, and very unlikely in Caucasians. What we do for treating these is we have lasers that take out pigment. So if it becomes darker, we have a laser to take out the pigment. We have lasers to take out the redness. The redness is actually blood vessels. So we have lasers that close those vessels off and the scar lightens. By doing that, it also decreases the, quote, inflammation that's in the scar. Laser genesis basically tones down the level of the scar. And there's also the old scar revision. So people who get a big ball behind their earlobe, what typically we do, we can inject some chemicals, but we have to use them safely, called Kenalog or methylprednisolone. We inject it into the scar in low concentrations, and slowly it causes everything to calm, and then we revise the scar. And we hope, the next time it doesn't heal that way. But, nothing's 100% with these scars.
Okay, thank you.
Thank you.